Good morning, everyone, here in the room in London. Welcome to this lovely venue and to our 8th Pediatric Kidney Transplantation Symposium. I'd also like to welcome the delegates who are joining online and wish them good morning, good afternoon, and good evening, because we have delegates joining from all over the world. The first Pediatric Kidney Transplant Symposium started in 2015. It was initiated by Professor Nizam Mahmoud, who wanted to provide education in pediatric kidney transplantation in the setup of the international multidisciplinary meeting. So the idea was that the doctors, nurses, coordinators, trainees, psychologists, and anyone who is involved in pediatric renal transplantation gathers with patient involvement and works on collaboration and networking and everything in order to improve the outcomes of children with end-stage kidney disease. 8 years later, we have a Transplant for Kids organization, which not only focuses on symposium, which is an annual meeting. This is the first face-to-face meeting since 2019 due to the pandemic. We also now have the Young Transplant Professionals Award, and I'll name those award winners a little bit later. We are working on developing transplant programs worldwide, and this includes surgical, medical, nursing education. And I'm very grateful to a lot of the colleagues in this room or who are coming to give talks at this symposium who will also be involved in these programs. It's a center-tailored transplant programs that we are aiming to develop. We started in Serbia in 2018 and restarted that in January this year. We are also working with colleagues in Cyprus and hope to start collaboration with Zambia next year. For all of those who are interested either in developing programs in their countries or interested in being part of our team, there is an email address which you can use to contact us. We have delegates coming to London from 12 countries, which I have listed here. So we hope that this will be a true networking and collaborative symposium. The registered delegates include surgeons, nephrologists, nurses, trainees. We have dietitian coordinators and some medical students as well. So I'd like to welcome you all and online participants as well. We will be live streaming this whole symposium, and we'll also be recording lectures which will be uploaded on our website 48 hours after the symposium closes. I'm delighted that after many years of planning, we have finally managed to get Professor Joseph Lim to come from Seattle to London to be a keynote speaker. Professor of Pediatrics at the University of Washington and Chief of Division of Nephrology at Seattle Children's Hospital. He also is Dr. Robert Hickman Endowed Chair in Pediatric Nephrology and past President of the American Society for Pediatric Nephrology. Probably the most well-known to all of you in the room as the Editor-in-Chief for Pediatric Nephrology, so maybe an excellent opportunity for networking. We are very grateful that you came all the way from Seattle to join us for these 2 days. The Young Transplant Professional Award was established this year. It's sponsored by educational grants from our sponsor, who I will thank in a minute. And there were 3 award winners this year. Dr. Ana Petrovic, who's a pediatric nephrology trainee from Serbia, Dr. Eftihia Todi, who's a just qualified pediatric nephrologist and started her work in Cyprus, and Dr. Panoraya Paraskeva, who's a transplant surgeon from Greece. Nico certainly would not allow me to give awards to all the nephrologists, so we are grateful that Dr. Paraskeva is here. We sponsored their accommodation and travel to this symposium, as well as 3 days observership at Great Ormond Street Hospital. So well done, the 3 of you who have won this award. You will get your certificate at the end of the conference by Nikos. This meeting would not be possible without the sponsors, and I would like to use this opportunity to thank Sandoz, who has been supporting this meeting since 2017, and also PharmaPal, who is our new sponsor and supporting us from this year. For those of you who have signed up for dinner, this will be at 6 o'clock this afternoon. It's about 5 minutes walk from here, and I'm sure that Dr. Papadakis will be helping us and guide us the way. The reason why I'm saying that is that there is a little bit more for some of us or some of you to this symposium than science. 4 years ago, Sanya, who is in the audience, and George met at this meeting, and I have asked George to escort the delegates and help them get to the restaurant. However, he was only interested in escorting one particular delegate and actually got cross to me. This is little Nikos, who has come along the way, and I've just learned over this weekend, and there's another boy on the way. So I hope that you will enjoy the conference, science, and whatever comes in between. And thank you all very much for registering. So we will start now with our first speaker. So I'm delighted to invite Maria Skanes, who is a dear colleague of mine. Maria is a senior renal nurse. She's a transplant coordinator at Great Ormond Street Hospital for Children, and pretty much all the work in transplantation that we do is fantastically coordinated, organized, and led by Jan and Maria. So Maria, thank you very much coming to talk about the transplant workup for children with infant onset end-stage kidney disease.